Hey Kuzi Talks family, welcome once again to another episode of Kuzi Talks show. We are on episode 4 and I am so thrilled to have these two gentlemen here with me. I'm joined in by Mr. Mono Mukundu, Clive Mukundu. He's a well-known guitarist. He's a multi-instrumentalist as well. He's a producer, and we are happy to have you here at Kuzi Talks. Welcome, Mono Mukundu.
Thank you, Dorcas. Thank you for having me.
And joining me again is Dr. Nkululeko Dewa. He's an addiction counsellor in the field of multiple species, pathology, and diagnostics. He also is the founder and CEO of Inner City Mission Zimbabwe and International Wellness Center. It's a rehab center in Ruwa. Welcome, Doctor.
Welcome, Dorcas.
Thank you. All right. So today, guys, we're going to be talking about mental health awareness. And, this is a topic, or it's a situation, or it's a condition that some people have. And we really do not know how to handle these kind of people with mental health issues, be it depression, be it, a proper drug addiction or a drug-related problem, or anything to do with mental illness or mental disorder. So I'm going to start talking to Mr. Mono Mukundu, Clive Mukundu. What is your thinking on mental health care?
I think when it comes to mental health, our biggest problem as a nation is believing too much in superstition.
All right.
Because every time we have a mental health patient amongst us, we always attribute it to spiritualism. That person was bewitched, or there are some evil spirits wanting the person, and so forth. Mm-hmm. So as a result, we end up not prescribing the correct solution.
Oh, yeah.
Because when somebody has got a mental health, the first thing they need is a psychiatrist.
Mm-hmm.
The first thing they need is a medical doctor. Mm-hmm. They don't need a prophet. They don't need a nganga. And that's where we get it wrong. Because personally, I live with a very close somebody who has had mental health issues since year 2000. So it's now 21 years.
Wow.
And if you see her, you won't even notice that she has a problem, because she's always seeing a doctor, she's always taking a medication.
Yeah.
And one time, somebody led us to a preacher. Mm-hmm. Who prayed for her and said that she's not supposed to take any more medication because I've prayed for her, she's now okay. But we ended up with serious consequences later on.
Yeah.
So basically, my point is we need not to spiritualize mental health issues. We just need to talk to the right people.
To the right people, yeah.
We need to talk
who
to
are the
doctors.
medical people, isn't it?
Who are trained for
Yes.
that.
Oh, wow. Yeah, you mentioned about the spiritualism. Yeah, in our African culture, we're so quick to say akaroiwa. The reason why asiri kufunga zvakanaka, asiri kuita zvakanaka, pane hama yake iri kumuroya. And that's a reality. That's us black people. We are so quick to just judge and conclude kuti pane zvakaitika chete hazvingangoitike, and which is a bad thing, because you get misled, whether it's the religion or even kun'anga kwamataura kuya vanhu vanokuitisai zvinhu zvisingafaniri kunge zvichiitwa. Like you rightfully said, kuti we are supposed to quickly go to the right people and get the right solution to our problem. And you mentioned you've stayed with this person for 21 years now. How difficult has it been, or how have you managed to overcome the challenges that you've faced over the years?
We happen to have a very good doctor. He's called Dr. Chibanda. Chibanda.
Yes.
The good thing about him, he also took time to counsel me, to let me know how the condition works.
Wow.
because at times you really need to understand how these conditions work, because at times somebody may just become moody and then you just think kujaizwa, or he can be rude, and then you prescribe the wrong solution and then the situation even becomes worse. So I think the thing that really has helped me throughout the 21 years is the counseling that I got from Dr. Chibanda, as well as read and research about the condition. So as a result, whatever happens, I know where to put the blame and how to deal with the situation.
And it has really helped you?
A lot.
A lot. And even the patient?
A lot.
She has really improved. Do you see any changes? Explain her situation. Has it improved from day one up to now, or it's stable, or maybe explain her situation as well?
It has improved. There are now very fewer relapses, but the most difficult part was the early stages, because we didn't know what it was. Yeah, so it was so confusing and so disheartening. So after some time, that's when we started noticing, I think this could be a mental problem. I don't think this person is in a right state of mind. So after taking it to the hospital, that's when we were told that this is a psychiatric problem, and you need to see a psychiatric. So after seeing a psychiatric, things became better, and at least we became informed on how to deal with the problem. That's why I say most of these people that we see in the streets, I think the majority of them could be okay at home if they received the proper care and attention.
And because they are now in the streets, they even get worse.
They get worse
because they're dealing with a different environment. They're dealing with a lot of other challenges that they are not supposed to be exposed to. So it comes back to the home, which is where we really wanted to talk about. The home, how we treat these people really matters for them. For them to even get better. So you're a strong man.
Thank you.
You are a strong man, and we really applaud such people, because you could have just washed her or taken that person to other people to take care of her. And we really need such people like you in the society who really brace up and say, I'm going to take the bull by its horns and really deal with the situation that's at hand. So thank you so much for that, Mr. Mono.
Thank you.
Continue doing the good work.
Thank you very much.
Yes. So over to you, doctor. I'm going to ask you a question that probably you can enlighten us on. What are the causes of mental health illnesses?
Okay. Thank you very much, Dorcas, and to the viewers too. Probably there are various causes of mental health problems that we, at the end of the day, see. And each of the mental health causes leads to a certain presentation. So different presentations come in different ways because of the different environments that probably one patient is exposed to. There are some which are natural. Probably they could be genetic, and some are actually induced by certain traumas, underlying traumas that would have someone has been exposed to. For example, I'll go to in my field where there is drug and substance abuse victims. It starts with a discomfort. It does not just start as an addict. No one was born an addict, but something somewhere went wrong along the way in life. Probably it could be some family discomfort. It could be some probably peer pressure from peers. It could be one thing or the other, but it's a discomfort to the individual. And then probably one can't cope with that discomfort and needs to go into probably a coping mechanism. And in the choice of a coping mechanism, one can choose wrongly. Start with probably one pull of a drug That leads to the next and to the next until someone is a full-blown addict.
Right.
So basically, the causes are diverse, from hereditary causes, from traumas that probably one undergoes in life.
Right.
Yes.
And how do you describe depression? Is it part of a serious mental health, or it's just a condition that maybe you're going through something in life and then you just undergo depression? Does it then also lead to a serious mental health issue, or where does depression come in?
Right. It starts with the discomfort, as I said.
Yeah.
That discomfort because you are not finding solutions to the discomfort.
Right.
So it leads to the next stage. So it's a progression from one stage to the next to the next. So the discomfort comes, and when you can't handle it, because it's a cycle where you can't find the answers. When you can't find the answers, it becomes depression now.
All right.
From depression, then it leads to the next stage. Sometimes you are looking for coping mechanisms.
All right.
And then probably when you want to develop some coping mechanisms, then you go into substance abuse.
Right.
So you look at everyone that probably is in substance abuse. You will find a series of presentations from point A to point B to point C to point D. And you can actually trace. One of the fundamentals in therapy or in interventions, be it medical or psychosocial, you realize that when you come across a patient of that nature, the first stage is to establish. That's the assessment that is done. And in most cases, a psychiatrist is the most relevant person to do the foundation intervention, because they are doing the assessment.
Right.
This is when probably we would need also diagnostic aids. Like you want to run some tests to find out, is it drug induced or it's merely a psychiatric presentation.
Okay.
Because there's two basic presentations there, which can either be drug and substance induced, or it's a purely psychiatric case. So that is very important to establish. But as a nation at this moment, unfortunately, our approach is one size fits all, where drug induced and other psychiatric situations are presented and handled the same way.
The same way. Akaroiwa.
Yes.
That's
yes.
our approach.
That's our approach.
Yeah. Okay. So I've noticed, like recently, or like in our current situation right now,
Yes.
we do have challenges like financial constraints.
Yes.
Right, we're going through economical hardships right now in our country, in the nation. Those kind of things, don't they bring depression or any form of mental health illness? Because
yes.
we're going through a lot of hardships, and then you find yourself in your own little corner. You don't want to talk to people. You just want to be by yourself because you don't know how to handle situations. You don't know where to find help. You don't know where to find money for the next rental.
Yes.
You don't have money for food. You don't even know where you're going to get money for school fees for the kids. And somehow it really dawns down on you, and it starts haunting you. It starts eating you up. How do you guys then give us advice to manage and cope those kind of situations?
Thank you, Dorcas, for that very important question. You see, the mental health per se is a broad field, very broad, but it's got its subunits.
Right.
In terms of when you want to employ certain protocols, you have got to develop certain supportive infrastructure so that you are able to deliver certain services in mental health. Just like you have rightly said, the economic meltdown brings a lot of different mental health presentations.
Yes.
And different people handle different pressures in different ways. And we've seen a rise probably in addiction because when people don't cope, a lot of people end up indulging in drugs as a coping strategy. But if you look at addiction itself, it's not like it brings solutions. It's a temporary relief. Just like when you handle, I'll put it clearly, like I said, there's two kinds of interventions in terms of our psychiatric presentations. There's pure psychiatry, like my colleague has just talked about. A psychiatric case is handled in a psychiatric way. That's a pure psychiatric situation. But however, there is other presentations. Now, in my field, we are saying it's a drug personality presentation. But in psychiatry, what they will say, this is psychosis. But in my field, we call it the drug personality presentation, because there is a trigger to the presentation. And the trigger is identified. How do we identify it? When someone is presenting, there's certain samples that are taken, and there's certain scientific tests that are carried out, and there's scientific evidence to say this one has crystal meth in his system. So his behavior is consistent with intake of crystal meth. So therefore, the protocols that come into play are very different from a mainstream psychiatric case. The drugs of choice that are used for psychiatric cases are what we call psychotropics. They alter the behavioral pattern of an individual. This is why when they don't take them, probably there's a relapse that comes into play. Probably I would like to go into the science of probably addiction, so that I make it very clear of how these two differ. When you take something that is intoxicative in nature, the body will biosynthesize it and use it and create intoxication at that moment. For example, in crystal meth, it will last probably 48 hours plus. You are intoxicated. But then what happens is the body is a machine. Already is thinking, okay, I'll need some more sometime. Thereafter, it will store excess in the fatty tissues as what we call a metabolite or a drug residue. Right, the presence of those residues in the body of a human being now is what actually makes these presentations. How is it so? When your intoxication levels drop, what the body will then think of is, okay, I've got storage somewhere. It will withdraw from the fatty tissues back into circulation. But it will be what we call sublethal doses of the drug. The sublethal doses, it means it can't elicit intoxication. So it will cause those, what they in psychiatry or in psychology they say it's psychosis, because it's a deficit created, and the body is screaming and saying, I want some more, I want to get high. But you can't get high because the quantities are below. So those are the presentations. A normally docile human being, or a person that you know very well, very docile, very sweet and stuff, he's got mood swings, he has violent dispositions, he can take the mic itself, which is worth maybe $500, he will sell it for $20 because he wants an instant hit.
I know.
Apparently what happens is all those normal functional, daily functional instincts go away because of that deficit. What remains is what we call the survival instinct that says, I want the drug. So that's why you realize that a normal person that you relate with normally, and who is so sweet, who is so supportive, who does certain errands and stuff, he can't, because there is this deficit created in his body, and it wants to actually fill up. He wants to fill up. Now, because he can't get the drug, so he goes into this survival mode. He can be violent to you. So a lot of people, when they probably the most especially in crystal meth, that is so prevalent. That's why I'm talking about mainly crystal meth, because it's the drug of choice of late. It's the drug which every drug addict is using in a lot of cases in the country. Now,
do you know it?
Yeah, and
crystal meth.
I know it through reading.
They call it guka. They call it dombo. They call it that. If you have seen these, most of them, a drug basically takes someone out of the present into the past.
Oh, so it actually
Yes, into the past.
rewinds.
It rewinds. So that's why these guys, they pick up the past. Probably one time, probably your brothers and sisters or your siblings, at some point you fought back then. They will rewind and bring it back to the present. They will talk about it. Probably they used to be in church, they used to be preachers. When they appear to you, they start visualizing themselves in church. And they start preaching, they start talking, they start proclaiming that they are prophets.
Wow.
I think this is very, very, very prevalent in most of them. Now, it's because now it takes them from the present back to the past.
Okay.
So their operational status now is from the past.
So it's a wrong term for drug addicts to say, I want to get high. It's actually get low. It's a get low because you're going backwards. Yeah. All right. Thank you, doctor, for that. Mr. Mono, I wanted to ask you, I'm sure you're in the music industry, and worldwide, musicians are known to be drug addicts. Most of them, they end up being drug addicts. I'm sure in the country we do have drug addicts in the music industry. Have you seen any musician trying to get help in any way, visiting a psychiatrist, or just trying to get the correct help from the right people?
I've been in the music industry for 33 years now,
Right.
and I don't remember a single instance of a musician seeking help.
They don't want it.
Kanawaripo, maybe they are there, but I don't remember a single instant when a musician was looking for help to get rid of addiction.
Or maybe it's because in the first place they're the ones who put themselves in the situation. They applied for it, they took it in, and they think it's the right way of doing things. When you're high, low, when you go on stage, you perform better. That's their understanding, right? Or that's what they were told drugs do to themselves. So what's your, after this discussion, would you think you can approach any musician whom you know is a drug addict and try and advise them to seek for help in any way?
Yeah, with musicians, we are known to be very egocentric. So it's very difficult.
What I know is the right thing.
So it's very difficult to approach somebody and offer help.
To seek for help in any way?
Yeah, with musicians, we are known to be very egocentric. So it's very difficult.
What I know is the right thing.
So it's very difficult to approach somebody and offer help before they ask for it. It's very difficult because remember the past few years I've been invited to a number of seminars to speak concerning the music industry, and I was shocked with the amount of backlash that I got from other musicians for pointing out very simple music industry mistakes where I thought I was helping, but just because maybe I'm not as famous as they are, or maybe because I didn't make as much money as they did, they just feel I cannot help them.
And you're probably attacking them.
That's
I'm
how
attacking
them. So basically, like I'm saying, like I've said, music. Most musicians were very egocentric. It goes. I think it just comes with the trade. So offering help to somebody who has not asked for help usually leads to very strong backlash.
I've seen a couple of Zimbabwean musicians, a few that I've actually seen naturally, who actually sick now. I would think it's more of a mental issue than anything else. How best do you think those people can get back on their feet besides you approaching them? Do you think we should get people like him maybe doing seminars? I don't know, just train, I don't know, some kind of talk to a group of musicians. Maybe doctor can come through on that one.
Okay, thank you very much. say, Mono, what I will tell you about drugs, they take an individual from a normal world into an artificial world. Don't expect them to pamper you because they are operating in their world.
Yeah.
But deep down, I will tell you that presentation is an alarm that says, I'm suffering. It's like getting yourself hooked. What then happens thereafter, you're not in control. So the backlash you faced, it's because it's people operating in another world and you are in another world. So you would never see eye to eye. That's why a drug addict, when he's at home, he's causing a lot of problems to siblings, to the parents and everyone else.
Yeah.
That's why you see their behavioral pattern changes. From someone who is interactive with the family to someone now who is very secretive. He goes to his room, he's not interacting with everyone. He feels that everyone is wrong except him. You see that? The problem is there has to be a particular approach to them. It's not like you go straight to him and say you are into drugs and can I help you? They will reject. They will be on denial. I'll tell you 99% of the patients that we attend to, firstly they will be on denial. They will tell the parents that no, I'm not taking any drug. I'm okay.
Yeah,
I'm
sorry
perfect.
to interject on that one.
Yes.
And it's not them who usually come to you.
Yes.
It's either the friend,
Yes.
the mother, the sister, or just somebody who comes to the doctor or to the
Yes.
psychiatrist and say, we need help.
Yes.
We have a situation at home. We've got somebody who really needs your help. And then you as someone who wants to help the next person, you
Yeah.
work hand in hand with the right person, and then you try and find the best possible ways of approaching the situation, right?
That's correct. That's correct.
Yeah.
These people, number one, they don't need stigmatization because what they are facing is actually now inherent in them. What it simply means is they have hooked themselves, but they can't take themselves out of the problem. I think you have seen in South Africa the other celebs, they went to Northwest for a show, and then after the show they got so high, it was during the COVID restriction era, they decided to drive back from Northwest back to Joburg.
Yeah.
They had an accident, I think 3 of them died, and you realize also, I'll take you also to the gold partners, most of them use drugs before they go actually into the shafts.
Yeah.
So you see the drugs actually make them make certain decisions
For them.
and they think, they don't even look at the risk factor, they don't look at anything else. It's not because they want it. I will tell you, if genuinely when they are sober and you are sitting down with them, they will tell you, I'm suffering. One of the big celeb singers that passed on, unfortunately, may his soul rest in peace. A certain pastor saw him during the beginning of the year, and they approached. He was ready to come for rehabilitation. Unfortunately, someone thought it was a spiritual problem, took him into some other church, and he went to church and they thought probably he would be okay. Unfortunately, this escalated until his death.
Big mistake.
Yeah. So there are 3 fundamental issues that probably I would like to address to everyone, even the viewers.
Yeah.
Number one, no one is born an addict.
True.
So it's like when I was growing up, I made certain mistakes, but someone had to stand in for me
Yes.
and correct me and bring a supportive background that made the correction possible. So these people need a strong support system. So among the musicians, probably you've got a regulatory authority, you've got these associations and stuff. We need to empower those so that they are able to handle their members properly, because without a supportive system, you're wasting time. When you administer therapy to addicts, it's not about him, it's about the setup, the entire support system. When we handle an addict, we handle the family. Especially the first 3-4 weeks, we're doing family therapy. Because you may not know, probably the discomfort is coming from the family.
Yeah.
You see that? It may be the trigger into drug addiction. So you are handling the entire value chain. You're handling the entire environment that he's living in. If probably you handle the family, if he's a musician, you handle the friends, you handle the people that are operating with him. Because if you administer the best treatment and he goes back into the same environment, he'll still do the same thing.
Yeah.
So you need the entire environment to be sorted out for him. Number 2, drug addicts probably should be separated from other psychiatric patients. Because remember, a drug addict normally drifts from normalcy to abnormalcy, normalcy to abnormalcy. So when he's living with the other side, especially in psychiatric units, it becomes a trauma to him because he operates in two worlds. The other person operates probably in a linear world. So the behavioral presentations that will then come may be a trauma to the other guy.
Yeah. During the rehab.
During the rehab.
Yeah, it's also
Those two have to be separated completely for the purposes of treatment. Because obviously the other psychiatric patients will have to live on psychotropics for life. But the other one needs to be separated because what you want to do is to take him out of the world that he's operating in and bring him back.
Yeah. Yeah.
So it's very important to separate the two. Number 3, what is important in drug addiction is to deal with the metabolites that I spoke about. When you don't deal with them, they will always relapse. That's why you see a lot of drug addicts, they move from one rehabilitation center to the next. They move from one cycle to the next. Why is it so? For starters, the drugs of choice that we use for them are called psychotropics. Psychotropics are basically more like sedatives. They are what we call mind alters. They are mood stabilizers. And if you check pharmacologically, their classification, you realize they are the same as those drugs that they are taking in terms of pharmacological effect. Because what you're doing is you are altering the mind by sedating the individual. When you sedate him, what you are trying to do is to contain his behavioral presentation. Now, when you do that to him, you are creating what we call a secondary intoxication to him. You are planting more metabolites into his system from what he already has from addiction. So what you need to do is to deal with the metabolites. How is it so? The approach is a detox program. The detox program is taking out those metabolites from the system. Firstly, it is the withdrawal completely from the source of drug or from the source of addiction. Secondly, it is to run a detox program. The detox will take away the metabolites or the drug residues from his system. When you remove those, what you are simply doing is he has no actually internal triggers. Because the triggers to all those reactions are because of the metabolites in his system. So when you deal with those, then you are done. And probably last but not least, it is the psychosocial support.
Yes.
You need to find out what is leading this person to addiction. Why does he prefer the drug? What is happening? Probably at home. He's coming from a broken family, for starters. So probably at home there are problems that are happening. There's GBV happening. They can't handle dad and mom who are fighting all the time. They can't. So because they can't handle them, all they end up doing is getting into drugs as a coping strategy.
Yeah.
So the whole psychosocial environment has got to be fixed.
True.
And it's a holistic programming. Thank you.
Right. Thank you so much, Doc, and thank you for so much enlightenment to this whole situation, to this whole mental health issues and mental health illnesses that we face, that people are facing as a society as a whole. And mukoma mono kune vafana vazara, the youths, the teenagers who are indulging in these drugs, specifically, especially kumaghetto. You find kuti patorine specific house inotozikanwa nzi apo ndo panotengeswa madrugs, and the people who you see there are the youths. They go there, they buy, they indulge, what do you think can be done to those youths, or how can we help to stop those youths indulging into those substances?
Apani point yambotaura nadokta yekunzi zvinoda a holistic approach.
Oh yeah.
Because mama problems aya mukangotry kunangana neka small group of people at times munopedzisira mangobata pamusoro mosiya modzi. Saka makids akadaro fana tichasa mumageto chimwe chiri kukonzeresa chiri kuencourage vanhu kutora madrugs imusic yavari kuteerera. Music yavari kuteerera because pane imwe music inopembedza kudhakwa, pane imwe music inopembedza chipambi, pane imwe music inopembedza malifestyles mamwe asina ngomira mushe. Because unoza tichikura isusu patakakura taitoziva kuti music kana kuteera paredhiyo hakuna music inokurudzira kurwa, hakuna music inokurudzira zvisina basa. Music yese yanga ingori music yaikurudzira kugara zvakanaka, kuremekedza vanhu vakuru. But izvi ndizvinotonzwa imwe song inototaura kuti ndinokukwapaidza, ndinokuuraya, ndinokuita se ichitopembedzwa. Imwe ichitonyadzisira outright kunatsotaura sezvazviri ichitopembedzwa. So I think panoda a holistic approach kuti even paredhiyo pacho music inoplaywa ichipromotwa yacho panofanira kupromotwa music inokurudzira unhu hwakanaka, isingakurudzire kudhakwa. Kuti kune imwe madoctrine kana ndingati mabeliefs kana matheories ekunzi ekuti mumwe munhu anotaura kuti hano zvandinoimba inini ingori entertainment chete, musateerera zvandinoimba ingoentertainwa chete. Zvanzi ko music yako iri kufurira vana vadiki kakuita zvakatonza aiwa iro ribasa revabereki vacho. But it doesn't work like that man, because people will never detach zvauri kuimba nezvauri iwewe nebelief system. Because kana uchitoimba uri kutogadzira belief system. Zvekuti kana uchiimba uchingotaura zvokuti ndinokwapaidza, ndinokurwa, vanhu vese vanoteerera music yako vakutoda izvozvo. Pane mumwe artist andichataura nezita kumagala aitwa aiti angoenda pastage angotanga kuimba, even nyange achiimba song yerudo vanhu vaitanga kurwa mucrowd.
Serious?
And it's not spiritual. I know what vanhu toda kumhanyira spiritual, it's psychological. Because ndo image, because music inofamba neimage.
You want to associate yourself with a certain
you cannot
message.
detach music from image. And the sad thing ndechekuti mumwe artist anogona kuweka image yake obva azvipresenta sechibhinya, but achingodzika pastage atomwe munhu. Zvafanana Beyonce pastage anenge asina kupfeka, anenge achiita sei achiita tumwe mamoves achinhingira, but ukamona off stage she's totally different. Munhu kwaye atori mukadzi womunhu and anotorespecta murume wake, she's very submissive kumurume wake. But ukamona pastage chinhu chichibhinya. Saka kuti uzotsanangurira the normal men on the street kuti image yakasiyana nezvinhu zvakaita munhu chaizvo. Zvafanira kuti I can give an example. This one is good there, so I think I can mention munhu wacho Winky D. Winky D ukamona pastage anogona kuita kunge munhu anodhakwa ngomuna, but munhu atori sober, he doesn't drink, he doesn't smoke. Saka ingori image. Saka I think apa pakuda kuti senyika manje vakuru vari responsible for nyaya airplay yemusic and everything. Vanofanira kunatsoscreena music inosimudzira kana kuti inokurudzira zvinhu zvakashata ifanira kupromota. Because ndikada paexample sedancehall. Dancehall inobva kuJamaica. KuJamaica kune culture yeviolence. Generally kunotone culture yeviolence. Because kuslavery vanhu vanga vasingakurudzirwe mamarriages akasimba. Kune yavaiti slave breeding. Yokuti ukatarisa kuAmerica kwakawanda zvaurimi zvakasimba zvinoana LeBron James izvozvo. Zvavaita mabhuru acho ndaitorwa obva amanikidzwa kurara as many women as possible, so that vanowana breed vanhu vakaita vakasimba. Because it was cheaper kuti vaberekana muAmerica than kuenda kuAfrica vachinotora nemaships. It was cheaper. Saka vaitiswa inbreeding yekuti unomanikidzwa kurara as many people as possible. Saka that element yakabvisa spirit came family. So munhu wese kuAmerica munhu anofila kuti ndakapenga kana 15 ndakatopenga iguru chichichi, but ukadatarisa kuno kuZimbabwe it's different. Munhu unorespect wanza ane mhuri yake chichichi, anochengeta mukadzi wake, anoita sese. Even iwe ukafamba wangopfeka chishoti mukadzi wake akafa nekuchena, anenge atonza akapenga, tasone zvakaita mukadzi wacho chichichi. Ona family yake vana vake vakaenda private school chichichi, unotobigwa because of that. Saka manje mama culture atakukopera manje music inouya kuJamaica vanotone culture yakadhakwa, just like hip hop culture kuAmerica, macultures iwayo akatodhakwa. Manje ninyaya yekuti necolonization colonization inoti muadmire kunze kupfuura imimi colonization inoti muvenge zvamuri saka because of colonization we've got a lot of self-hate ndo inoita kuti tifarire even pamusic dzekunze more than dzemunomu saka dzimwe dzai dzatakutora manje topatukutora like Zim Dancehall right now kuna anonzi Vibes Cartel atori mujeri kujamaica and is the biggest they are violent vanongoenda mazitatu vakableacha vachiita se ende kuuraya munhu ndizvo vanonge vachitoimba masongs kuti uraya munhu but ukambvunza vanongoza no it's just a song. It's not just a song. Entertainment is not just entertainment. TV program chacha is called a program for a reason. It programs your mind. So we need to be careful as parents manje taudzokera bheki kuti holistic approach kuti vakuru maauthorities ndavangwarire content iri kuridzwa pamaradios nepamatvs zvaizvongoburisa vakadzi vasina kupfeka muchingoti it's not just entertainment haisi kuperera ipapo then kuvabereki futi musangoregedza vana vachingoona zvese patv utoona umwe vabereki vachikurudzira vana kuti ndawaine it's a dance munhu ari kutoita mari nazvo no it's not just a dance pane zvazviri kutoita muvanhu so basically entertainment is not just entertainment it programs your mind so we need a holistic approach authorities maparents nemaguardians we need to see kuti zviri kufitwa vana vedu maziso munzeve chii
because like with technology they say garbage in garbage out so whatever you're exposing yourselves or your children or your family to is what then comes out.
Kana ukambona mavideo etu vana so tudiki so tuchimba song hanzi ndoda kudhomoka boys rangu ndoda kudhomoka boys ko wakatanga kunyadzira kuti kwatanga kuita same pari kusvita munhu mukuru aritowombera maoko kuti mwana wangu akapenga ende ndakaona kamwana kachi waine kachiita sekanyadzira pari kusvita mubereki wacho aritofunga kuti zvinoshamisira but hazvishamisiri.
No, in our culture it's actually so embarrassing.
Some adopted cultures atangoadopta tingofunga kuti entertainment but tisingafanira kunyeperana ndekuti entertainment inongoentertaina chete no entertainment it educates.
Right. Okay. No, thank you so much, Mr. Mono. Thank you so much, Doc. I think we've reached to the end of our program. It's been very, very educative. Thank you for all the enlightenment, right? And thank you so much for your contribution. And I really liked the part Yoyekuti. At home, you have a situation that you've dealt with, that you are still dealing with for all these years, which most people can't do. Most people then simply just take rehab centers and they just dump them. They dump them for years. They don't even visit. Or maybe if they are visiting, they're just visiting for a good 10 minutes and that's
Tokenism.
it. Yes. They just get there, they're paying and whatever, but they are not really interacting with the patient, with the family, with the person who really needs our support. So it's very important how we deal with mental health patients, right? How we treat them, how we talk to them, how we deal with every situation or every challenge that they're facing. So there we have it, Kuzi Talks family. It's been a pleasure. It's been a pleasure having these two gentlemen with me, and I hope you've learned one or two things. Thank you so much. Kuzi Talks.